And so we have Robert, do I pronounce it? Is it Dr. Cananello? There's a lot of,
Excellent. Well done.
I said it right? Yes. I just know there's a lot of N's and a lot of O's. And then we also have the team from Swift. We have Chris McNamara and Pete Turnbull, and they are going to open up Q&A throughout the presentation as well. So if you do have a question, obviously your mics are closed, but you can use your raise your hand tool. You can type into the questions box, and we will field those questions throughout the presentation. So don't hesitate to ask questions. We really want to keep this going back and forth and let you guys be interactive. And we certainly don't want you to walk away, with anything unanswered, obviously within the time frame though. At the end, obviously, you will get contact information for the Swift team. And so if for some reason something does get missed and your question doesn't get answered, you will be able to reach out to them. Are there any announcements that I'm missing, Anne?
We talked about Q&A, so type it into the whatever makes your heart happy, and we will take questions throughout. Because you're attending live, you are entered to win a $250 gift card. So that's exciting. So, Anne and Sarah are always open to receiving tokens of appreciation. So feel free to send that stuff along.
I like it when you talk about us in the third person. That's exciting.
So, all right, it's a couple minutes after. Pete, do you want to kick us off with a little introduction of your team and your products?
Yeah, perfect. First of all, really appreciate you guys putting this together. Our partnership with you guys has always been really great. So really appreciate you doing this. My name's Pete Turnbull. I am one of the founders of Saorsa, and we represent the Swift product exclusively here in the US. I'm joined down at the bottom by Chris McNamara, who's just had the first technical glitch of the evening.
I'm back. I'm going to use my phone. It seems to be the best connection. How is it coming through? Just out of curiosity.
Great.
Okay, good.
So
Hi,
Chris
everybody. Nice to be here.
We good to have you. We launched this business in 2019, but Chris is a good long-term friend of mine. So we'll have a nice chat together tonight. And then we're joined by Dr. Rob Cananello, who we're always really pleased to have join us. He's the most experienced Swift user in the US. He's now probably one of the most experienced globally. And some of you on the line may have heard him speak at a few of the conferences virtually hosted in the last couple of years. But tonight will be exciting because Rob's going to share some of the data that he's collected. We're publishing the first US case study on Swift, which we're really excited to do. So Rob's been instrumental in pulling that all together. Not yet published. This is a sneak peek at some of the data. So welcome, Rob.
Thanks for having me. It's really exciting to be here and to share some knowledge and best practices.
Love it. Okay, so we'll dive right in. I think, as Sarah and Ann mentioned, we want this to be interactive. So if you guys have questions, feel free to throw them at us anytime. We'll do our best to answer them through as we go. We'll take sort of short pauses and answer them along the way. But why don't I start sharing my screen and we'll dive into this presentation. Let me know when you guys can see.
Will do. Okay.
Can you guys see that screen?
We can see your screen and every exciting tab you have opened.
Can you see the Swift US case study review? Is that what we're looking at?
Yes.
Yes, sir.
Okay.
Yes, yeah, you might want to go ahead and put that in. I don't know if you want to put it in slideshow mode, that might be easier.
Yeah, I will.
Cool.
Is that full screen?
You're awesome. Good job.
Beautiful.
Take it away.
Okay, so this is this talk and with Swift, it's all about doing things differently. Okay, this is a different technology and it's a different approach to solving a traditional and very frustrating problem, specifically in dealing with Veruca. If you want different results, we got to do things differently. And so that's what tonight's all about, is trying to find a different way to solve this problem. And that's what Rob has done. So again, we've introduced Rob, but again, really just happy to have you here. Rob's been just an awesome guy to work with and has been a real pioneer for this technology in the US. So you can hear from him tonight. Two things we really want to cover, and we're going to try and keep this fairly basic. If you're on, you've got an interest in understanding Swift. You've either heard about it, you may not have heard about it, and you're just interested generally in hearing about new technology. But the two primary questions we want to answer: how is Swift going to help my patients, and how is it going to help my practice? Those are the two big sort of questions that we always get into with this technology. As a quick introduction, I'm just going to talk about the actual device itself. So we launched this business in 2019. We got FDA clearance in 2018. We've now done over 200,000 global procedures with a real-world efficacy globally of around 85%. Rob's going to show you some data tonight that is a little bit higher than that. But we've got really good now global data around the treatment of warts. The actual mechanism behind Swift is quite different. So we use a non-destructive energy, a microwave energy, to actually stimulate an immune response. So we go after HPV as opposed to trying to destroy a benign lesion. We'll talk about that in 1 second. And then a key piece with Swift, because it's immunotherapy, it sits outside of CPT codes. It's a cash pay treatment. We'll talk about the implications of that after we go through Rob's case study and how that can really be a benefit to your practice in driving profit into the bottom line. And we'll share some of the results that we're having on that side of things. In terms of how it works, this is going to be a very brief overview. Rob's going to talk about the impact. And generally, we don't actually like to speak about this sort of science too much outside of understanding what's happening. So really with Swift, as I sort of highlighted, we're targeting HPV. Okay, we're going after the root cause. The Swift treatment is actually very anticlimactic. The patient leaves, there's no scarring, there's no downtime, there's no blistering, there's no redness, there's no irritation. Unless they felt the actual microwave energy during the treatment, it would be as if nothing happened. Swift stimulates this immune response by using what's called heat shock protein 70. We use cellular chaos to release this heat shock protein, and that's what triggers this immune cascade. Any more science, we're happy to get into on another call, but it's not really the sort of focus for tonight's discussion. Tonight's more about what actually happens when we use it. And that's where I want to bring it over to our first value pillar. So this is the first area and the most important area behind Swift and what Swift is doing. And that's helping patients. So this is where I want to turn it over to Rob to talk about. We're also going to talk about this profit enhancement and how we can drive more profit to the bottom line. And we will talk about practice differentiation, how this can set you apart in your practice. Rob, I'm going to hand it over to you at this point to talk about your case study. So just let me know when you want me to change the slides forward, but I'll toss it to you now.
Sounds good. I was just thinking as you were talking, if I was to start a punk band, I think Cellular Chaos would be a great name. So we got to think about that for our next go around. Okay, so this is our study, and first off, I just want to say kudos to the team at Saorsa as well as Lesion, and to our really good friend over in the UK, Ivan Bristow, who is really, the pioneer in starting this and helping us move this along. So our data collected was from years of 2019, 20, and 21. Tough time to do this, right during the pandemic, but why not? If we could do it during then, we could do it anytime, I figure. We looked at 113 patients. Out of that, we utilized 59 patients in total. The way the protocol worked was the typical protocol we use for Swift, which is we put it at a setting at 8 watts. We delivered it 2 seconds and 5 doses, and treatments were delivered a month apart. And then we looked at the patient's 12 weeks follow-up for that to see the final assessment. And this is the only therapy we used. We didn't use anything else at this time. And these were patients, for the most part, who had been dealing with these lesions for quite a bit of time. Next. Okay.
I threw this in there, Rob, because I hadn't talked about it. Sorry for that curveball. This is just this is a slide really on what the treatment is, because I hadn't covered it previously. I know in your previous presentation you had. So the way we work with Swift, to give everyone the scope of treatment, it's on average 2 to 3 treatments. Rob will talk about his averages that he saw in his study. And we space those out 4 weeks apart so that we can align to the immune cycle. And then we do a follow-up at 12 weeks. And Rob's touched on the actual power itself.
Yeah. Next. Okay. So, this is typical. What do we want to do? We want to be able to use our swift treatment and see things go away, right? That's the hypothesis that we hope for. We want it to be an effective treatment. And, what we did was that we looked at 2 different scopes here. We wanted to see the completed treatment, and we wanted to see, I just want to see, mine wasn't coming up there right away. Sorry. Okay. So what we did is that we had 59 individuals, and our efficacy came to about 87.8%. Next. So yeah, like Pete was touching on before, what we noticed is that the number of treatments that we needed was 2.4 treatments. That meant that some people were lucky enough after 1 treatment, they had total resolution, and some individuals had to go a little bit longer than that. And like we said before, the typical treatment was spaced about a month apart. And we found that there was not a statistical difference between those patients that had prior treatments, 5 or more, before that had failed. Next.
So Rob, just to touch on that, sort of jump in.
Yeah.
So no significant difference between 5 or more patients. Did that surprise you?
It did. We figured that there would be like the newer warts and the older warts would be a change, but there really wasn't that much of a difference, which is interesting.
Yeah. Okay.
The age of the lesion, that's where we did see some things that there was a statistical difference. So the older the lesion, the longer it took to go away. The newer lesion, obviously, it went away a little quicker. But there was no correlation noticed between the lesion's age and the number of treatments required to treat them. So they, like we said, we had 100% resolution for all the ones that we put in here for this. Okay. This was interesting. So the age of patient, what we found was, we'll go back first. The median age, as you can see, was 24, but we had people close to 80, and we had people under the age of 10. But there was no significant difference. And I thought this was kind of odd. I thought we were going to see, younger patients, their lesions resolved quicker, but there really was not a statistical difference between adults and children in the resolution. Pete, did you kind of think the same thing? We see differences with younger patients?
Totally. Yeah. We typically, so your comment is right. So that because it's an immunotherapy, typically we see terrific results with these younger patients, and it's usually the older patients who have a more weakened immune system where we see a lower rate. Statistical analysis, though, I suppose that's the part when we look at this, and we had our statistical analysts detail it. Anecdotally, I think we would all say younger patients do better, but from when you look at statistical analysis, there wasn't actually that significant a difference, which was a surprise.
Yeah, I think if I was to touch on that one thing, though, I would probably say the younger patients had more lesions and older patients had bigger lesions. So right. Maybe it had something to do with it. There was no statistical difference between the sex of patients. I will tell you that the men seemed to be more nervous about it than women. Women were more chill, but there was not a statistical difference between the sexes.
Got it.
So this is the very important part of it. I want to skip all the way down to where it says 93.2% of the treated patients reported the pain to have disappeared post-treatment. And that was usually after the first treatment. And that was really kind of a neat thing, because these are patients who usually were coming to me dealing with some kind of discomfort or not be able to do their activities of daily living or do their sport. And they were saying, the lesion might still be there, but does not bother me anymore. And what we learned from that was that we were on our way to getting resolution when we started hearing patients say that. So that was really, really pretty neat. As far as adverse events, the only thing that I did notice was that early on, when my very first individuals did ulcerate, And that was one of the individuals that I did inject locally. And, I think, our theory behind that is that we probably caused a bit of a steaming effect when we're heating this lesion as opposed to just heating it. Yeah.
Got it.
Next. So this is what we wanted to find. We had 59 patients here. We had an 87.8% efficacy. That's tremendous. If you think about what we usually utilize and see with things like cryo and sal acid, we're talking of resolution rates of under 30%. So this was tremendous. It was great. Now, the fact that we were able to do this sometimes in less treatments than we had told the patients, as we said, the median of 2.4 was great. Younger lesions did respond more favorably than older lesions, and that's what we kind of expected. And pain did not limit the treatment or efficacy. Patients were able to continue on with their daily activities, which is great. Like Pete said earlier, there's no bandaging. There's nothing that we have to worry about post-treatment. Patients just go on and do their thing. So it's really, really a highly efficacious type, like I said, patient-friendly treatment for treating these lesions. And I think the biggest thing that we learn with dealing with these patients is just helping them understand that it's different. It's like Albert Einstein said, you got to try to do things differently. So it's not the typical thing we do. We're now doing immunotherapy instead of trying to just beat up the skin. So it's really an excellent and positive new way of treating HPV lesions.
Yeah. The part that I think was really pleasing for me, if I can just speak to it, I know we had Ivan's study, which was sort of the first study that took place over in the UK in 2016. In that study, they saw a 75.9% clearance rate. If they took the data later, it would have been about 83%. But that was, those were under fairly rigorous, study conditions, and was as they were first launching. I was really curious to see how this would go in a real life setting in Rob's practice. I don't know, Rob, how many patients do you see in a day? Maybe just describe your practice, Rob, like in your, how that works.
So I see in a typical day anywhere from 25 to 30 patients. In a typical day, I'll probably do anywhere between 2 to 5 Swift individuals. I will tell you that anecdotally now, I think I'm getting close, if not over, to the 1,000 treatments, way over 1,000 treatments, but patients probably over that pretty soon too. And I would say that number of 87.8% is definitely even higher than that. Just because a lot of the patients that we do now, we might see it might take a little bit longer than the 12 weeks, but they do resolve. And I feel confident that I can resolve any lesion as long as we continue with the protocol or just give it more time.
Mm-hmm. Yeah. So again, people can relate to, the type of practice that Rob is running, very sports management oriented. Rob treats a lot of athletes, whether it's everyday athletes or really competitive athletes. These are people who value being on their feet. So the treatment obviously is very, very attractive to them. But for me, it was interesting to see in a practice setting, a busy practice, how is this going to go as opposed to more of a research oriented practice, which is what Ivan runs in the UK. So that was just really, really encouraging to see. It matched up anecdotally with what we're seeing. And then when you compare it to other relative studies, so when other technologies, when other modalities have been studied, really there aren't many plantar wart specific studies when you look for them. The ones that you do find, the EverT study is probably the most comprehensive. And that showed a treatment efficacy of, I think it was between 30 to 35%. It was not much higher than placebo. It compared sal acid and cryo compared equally, sort of as poorly, I suppose. And so when you're talking about efficacy in a study environment of between 2 to 3 times the efficacy of comparable modalities, that's something that really stood out for us. And we'll talk about why that's important next and why it's so important to be confident in your treatment efficacy. Because as we'll sort of transition to now, having that confidence is just so critical to being able to get patients to commit to Swift therapy. And that's something we'll speak about. Chris, I just want to ask you, are there any questions that have come through? We're going to get to Rob's case studies in a second, but are there any questions that have come through as yet?
So far, I think Anne has asked a question to the group. I'm not sure if there's been many answers thus far. Okay. I don't believe so.
But no questions that have come up?
No, none that I can see so far.
Okay, great. Rob, we're going to push through to your to the cases. If you want to just speak to some of these particular individuals.
Sure. This is case number one. It's probably my most intriguing individual. This is an individual that had cystic fibrosis, went on to have double lung transplant. After having double lung transplant, he was immunocompromised and taking many different types of medications to keep him in that realm, to keep him healthy. He was moving forward with his recovery, and he was continuing to be doing his athletic endeavors, including cycling. And he said, all of a sudden this started to happen. And he wound up getting several hundred warts on both feet that were just so painful that he couldn't even get his bike shoes on. Ironically, his wife is an office manager for a very large dermatology office, and he had been treated with everything under the sun, and nothing helped him. He said, hey, let's give this a try. So we decided to give this a try, and we started doing this in February of 2020. So we gave him his first treatment, and you can see it's a large area, so we kind of like picked and choose different areas to do it. And then, we came back a month later and they were still there. And we did it again. And then COVID hit and pandemic hit. So we lost him because everything closed up. So we couldn't do his third treatment, but lo and behold, he sent me a foot selfie. And the foot selfie actually, he was like, I can't believe this is totally gone. So and this is like one of the worst of the worst. And obviously, this gentleman, they all went away. This is I have to get an updated picture. I haven't seen him lately in the clinic, but he sends me notices all the time. He goes, I don't have warts anywhere. And this is an extremely immunocompromised individual. So super duper success story for this patient.
Yep.
So here's an individual, one of my early on ones that had, as you can see, multiples, and they were quite painful. And this kind of went as planned. We did 3 treatments, and then we gave him some time off, and he had complete resolution of all areas. If you look at the far right picture, you could say, wow, there looks like there's something going on there. No, not really. That's normal hyperglyphics, dermatoglyphics, I should say, related to all of those areas. After the first treatment, he was one of those individuals that had absolutely no pain. Now I was able to do my activity. So that was pretty neat. This is an individual who is a physical therapist. He's a provider to me of referrals. He's a runner. He had this lesion that he was trying to self-treat for quite a bit. You can see how beat up it looks with sal acid. This was interdigitally between his first and second toe. He couldn't run, he said, because it was so painful. We did 1 treatment on him. He came back in a month and it totally had resolved. So getting many more referrals from his physical therapy center, which is great. And it worked out great. Next.
Want to speak to your work with IPKs, Rob?
Yeah, sure. So, we said, let's just see what happens with IPKs. We didn't really know how it would work out, but we had this one individual. Pete, I don't know if I can't see the pictures popping up here. I don't know if you see it on your end or not. Maybe not. Okay. Yeah. So we said let's see what happens with this. This is an individual. There you go. 86-year-old lady. She's had lesions forever, and she would come to see me about every 4 to 6 weeks just to get these debrided. So we said, let's give this a go. So we gave this a go. Same kind of protocol. Actually, what we did is that we actually lowered the wattage a little bit on these individuals. We probably put it down to 6 watts as opposed to 8 watts. and 2 seconds 5 times. And the patient said after the first treatment, she said, I feel tremendous. So she goes, you know, it was really interesting to have an 86-year-old individual come in and say, I would gladly pay for this so I would have decreased symptoms. You know, the one thing we kind of trying to figure out, like, why does it happen? Because it's not a viral situation. But the more I look at these lesions, the more I blow them up, I'm noticing that they have abnormal dermatoglyphics, and maybe there is a viral component or maybe even a bacterial component that's helping regenerate tissue in these areas. But, you know, long term, the patients are super happy, and they've been glad that you know, we were able to offer this to them instead of just having them come back for routine debridement. You know, and what I like about it is that, you know, I want to find a multitasker in my practice. So here's something that we could utilize for multiple different pathologies.
Yeah. Yeah. This is an area that we're now doing more and more study work into after the success that Rob and Ivan and a few others have had, you know, with these, what we considered to be, you know, traditionally more biomechanical issues. But as we're looking deeper, there's some studies we're finding and some of the biopsies we're doing ourselves that are showing that more than 50% of these are coming back as being positive for verruca. So it's exactly to your point, Rob, you know, what one consider to be biomechanical, actually it looks like more than half of them are viral. So just deeply seated warts. So either getting full resolution, and we've got another study we're actually going to be releasing fairly soon into IPKs where we're seeing, you know, more than 50% of these lesions are fully clearing, which is brilliant.
And the thing, like, you know, just like with the verruca, lateral compression on these things usually make them jump off the chair. You know, when they come back after the first treatment, they're not having that scenario at all, which is really outstanding.
Mm-hmm.
Pete, we did have one question come in from Tracy Toback. He says, as a Swift user, I was under the impression that an immunocompromised patient would not typically respond to microwave therapy. Have more recent studies changed this outlook for efficacy? And if so, how would the proposed protocol differ from the standard?
Yeah, so I'll answer that question. That's never been the case. We never have said that immunocompromised patients could not utilize this. As a matter of fact, I've done it on multiples, patients with rheumatoid arthritis and other type of individuals that were also immunocompromised, diabetics as well. Not an issue at all, and the protocol would not change at all.
Yeah. And just to add on that, Tracy, because I know we've maybe chatted about this a while back. The big thing with immunocompromised patients is probably setting the expectation that it could potentially take more treatments than the average because of their weakened immune system. It won't necessarily be the case, but if you set the expectation that it could be beyond 3 treatments and to be patient because of their weakened immune system, that's usually suffice, and we still can get a really nice outcome.
Yeah. Yep. Yeah. And I mean, there are certain, I mean, again, to Rob's point, I think it'll be interesting. I'd love to do another study on, you know, hey, why isn't it 100%, right? Like, why can't we get there? Now, some people will argue, Dr. Bristow in particular, and I know Rob, like, I know Dr. Hochstein also, if they have more time, if they can keep going with these treatments, they would expect to get much closer to 100% efficacy if they were able to go out 7-8 times. You know, a lot of patients don't like to continue with treatment once you get past 4 or 5 treatments.
Yeah, I got to tell you, the pandemic was awesome for this because we did lose a lot of people to follow up. And then when they started coming back around, their lesions were gone, you know. So that was, and you just realize you have to be patient. It's not like we used to, it's not destructive. So it's going to take a little bit more time perhaps with some of those patients.
But Tracy, to your question, it's an area that we really want to study, right? It's like the smaller segments, like what happens, why longer? You know, if we look at a cohort of the 10% that didn't respond, why is that? Was there a link between some kind of, you know, immunosuppression or was it just purely, you know, a dosing question? You know, don't know. Those are interesting questions for us to constantly look at, is how can we get this thing yeah, we're really happy with 87, 88%. That's amazing. We'd love to get it to mid 90s. Let's try to get to, high 90s. I know, Rob, for one of your patient cohorts, your younger patients, you got a bunch into that sort of that mid 90 clearance rate. So how can we get all of them there? That's kind of our challenge.
Yeah, and I think a lot of it's going to have to do with consistency in the way we do it, following the protocol, and like Pete said before, giving realistic expectations, and so the patient doesn't get too frustrated and continues on.
Yep. Any other questions?
Nope, that was good, Pete. Thank you, Rob.
It looks like Dr. Toback is typing something, a question for Rob, so we'll just wait and it'll pop in a minute.
Sure.
Perfect.
Okay, we sort of touched on these, but we'll start to transition now more into the commercials. So if we talk about the advantages of microwave, treatment time, we're talking about, Rob, how long would you say your average treatment is with Swift?
Like in the room treatment? Yeah. Maybe 5 minutes.
Yeah. So it's a 5-minute treatment. Like the actual delivery of energy, if you've got a singular lesion, is 5 2-second doses of energy. Yeah. So you typically move them around, you communicate to the patient, but we're talking about a very rapid treatment. Easy to use. So it's a point and shoot device, really simple to operate, predictable and repeatable, no anesthesia required, no smoke produced. So no need to mask, especially with HPV, no post-op dressings or special dressings required, and no patient downtime. So really good for children, really good for active patients also, those two specific cohorts. But I would say, and Rob, you can correct me if you see differently, but the real value for Swift in my mind is in those patients who have no other options. This is really where we're seeing the true clinical value in Swift, is for that patient who's gone over the counter, been to primary care, nothing's worked, been to a dermatologist, they've tried a few different treatments, nothing's worked. Those are the patients where we're still seeing that mid 80s% efficacy. And that's, for me and for I think most users, the true value is you get to take a patient from a dermatologist who's at the point of being extremely frustrated, and you get to give them quality of life back. Like some of the stories we hear and the video testimonials we get back from our patients are emotional. And I had no idea getting into this business that it was going to be that emotive. That's the primary advantage for me. Rob, would you agree, disagree?
Yeah, without question. A lot of these individuals, all hope is lost, and sometimes they're saying, well, we could do surgical excision of these. And, a lot of times that can be painful. I have patients who've come in and have had that done, and they've had residual scarring that's just really super uncomfortable long-term. So you want to try to avoid those things. So, giving them another option that is viable and is quick and efficient, it's a no-brainer, and like you say, it's a game changer without question.
Mm-hmm. Beauty. Okay, Chris, I'm going to tap you in here to talk about the profit enhancement and practice differentiation. So this is just a quote from Dr. Balick, and we connected with her also early in our journey, sort of by mid 2019, I think. She practices in Connecticut. She had just launched her new practice and was looking for things to differentiate this new practice. And Swift is one of the first technologies I think the first technology she invested in. And it's been just a great way for her to have helped build that new patient flow. So, these are great stories we hear from people like Rachel throughout. But Chris, I'll just sort of hand it over to you. We talked a bit about understanding this patient journey and why this is so important to understanding why patients are choosing this. So I touched on earlier that Swift it falls outside of CPT code 17110. So it's a non-destructive immunotherapy. So people or everyone's charging cash for this treatment. And we'll talk about the average treatment charge and how that works. The major question we get when we talk about this being a cash treatment is like, oh, will my patients actually pay for something that's not covered by my insurance when they have options to be treated that are covered by their insurance. And we'll speak about the percentage of the patients that are saying yes to Swift. But really, it all stems back to this patient journey and how frustrated these patients can get, which is what drives that. Because as we talked about, a lot of them are out of options. So it's not like they're choosing between options; they're out of options. Chris, I'll hand it over to you to just speak to the profit numbers.
Yeah, just really quickly to build off of the previous slide. I think it's really important that you as a provider do not underestimate the frustration level of these patients. They're at their wits' end most times. By the time they see a podiatrist, they are very likely recalcitrant and have been referred to a specialist for a specialized treatment. So that frustration element is the number one factor that kind of drives our commercial outcomes and the financial impact on your practice. A couple of other really quick things on that patient benefit slide or practice benefit slide. MAs can treat with Swift and be certified to treat with Swift. Always a nice thing to get maximum utility out of your device. So if you have any MAs, they can be certified. The other thing that's important to recognize is a lot of these patients that are coming for, traditionally destructive modalities that are covered under insurance are out of pocket for multiple co-pays with variable outcomes. And so the difference is that we're offering something that is very predictable, fast, clean, and efficient, but more importantly, gives them a very predictable outcome with a pleasant patient journey and a predictable budget to get rid of that lesion. So the alternative is variable outcome with multiple co-pays. Swift is high degree of efficacy, knowing what you're going to pay and what you get. So I think that's an important distinction as we get into the profit per patient. So we always like to show a profit per patient analysis, more to just generalize what we're doing, but also to show that, hey, you don't need to see hundreds of patients to make Swift a very profitable option, modality you offer at your practice and have that differentiation at the same time. So most of your peers lease the device. The device to lease with our incentives for the spring is $458 a month. So a real manageable monthly figure. We have the average treatment charge across our 300 podiatrists using Swift today is around $250. That continues to increase as your peers get more confident and see the outcomes that Swift is generating. We have a disposable tip that's used per treatment and is $68, meaning your profit per treatment with Swift is $182. And just to give you some reference, the average reimbursement for 17110 across all insurance providers is $83 in the US today. And again, that can come with multiple co-pays and variable outcomes. So this is an opportunity to make really good profit for the amount of time you're putting in. The average treatment per patient of 3 that we've already referenced yields a profit per patient with Swift of $546. Why this is relevant and why we like to show it is the profit generated from one Swift patient covers the cost of the monthly lease. So when you think to yourself, how many Wharton IPK patients I see in a given month, one of those will cover your investment cost. I think that's really important financial metrics to look at. So very minimal. And then more importantly, on a more holistic level, it takes about 45 Swift patients to pay off the device in its entirety. Or if you're considering Section 179 tax savings, which is real dollar tax deductions and savings, it takes about 30 total Swift patients to pay off the device in its entirety. So ROI across our 300 some odd providers now is less than 10 months in podiatry, meaning they see those 45, or if you include tax savings, 30 patients within those first 10 months and have the device paid off. here's some metrics just that we live by. 132% annualized ROI. That's that less than 10 months or less. 30 patients total, Swift patients total to pay off the device. And this needs to be updated actually, because our conversion rate has now crept up to 75%. What we mean by conversion is really the cash acceptance. And that is a metrics that says, hey, if a patient comes through the door and is presenting with a wart, 75% of them will say yes to Swift right out of the gates. Where that number gets even stronger or more attractive is when that patient has had maybe an insurance-based, more destructive method, and that has not worked out well. And they come back and you now keep that patient, you retain them, and that percentage of cash acceptance goes up. And the other piece being when we recruit those patients on your behalf and together with you, then we have obviously very, very high, close to 100% cash conversion of those patients.
Rob, and the 75%, let's say, is an average. So, typically it takes about 4 to 6 months before you yourself feel very confident in the outcomes you're getting, because of the treatment regime. It sort of gets to that stage. At 4 to 6 months, you can say, wow, I know that I'm now seeing 80+%, or you can really put a claim on what you're seeing. That then enables you to present the treatment in more confidence, or with more confidence. Those more experienced users see a higher acceptance rate. Rob, what does your acceptance rate look like at this stage in your practice?
Yeah, it's really rare for someone to say no. I say it's 95% and above. And as like Pete touched on, it's a journey. The more confident you get, the better you're able to explain to the patient, the better you're able to show them, before and afters. And, to be quite honest, between what Saorsa does by sending patients your way, as well as, for me, one of my highest referral sources are other podiatrists. So, these patients are coming with confidence that this is going to be their answer to their problem.
Yeah, that's been a big part, and we'll touch on that next. Is the marketing piece and referral pathways that we're able to create. Most people don't like treating recalcitrant warts. That's just a fact. They call it an ego killer. It's what most dermatologists call it, because there's nothing you can do. HPV is a very, very stealth virus, and it's the nature of the virus. It's not the ineffectiveness of what's available now. It's the fact that HPV is really tough to treat. It's just a fact. And so a lot of people, when they find out that there is a location nearby to them that can give their patients, an 85% or higher better chance of success, they're happy to refer them off, knowing that they're going to, keep that patient happy, and hopefully they can try to retain them. So that's been a really good source of new patient flow for our practices. Chris, do you want to speak to this, Rob's case study?
Sure, yeah. And Rob, thanks for disclosing this. It's just really to illustrate the impact that Swift has had on Rob, a real life Swift user and peer. You can see that he's done well over 500 Swift treatments.
And this was taken probably about 6 months. So this is now over 1,000.
Yeah, it's well over 1,000. The profit per treatment on average is $182, and Rob's pricing model has continued to steadily climb as far as I can recall over the last 3 years, because of the confidence that he's seen in the outcomes and the willingness to pay for the outcome. Total treatment profit has been it's now well over 100,000, but at the time was almost $93,000 over 30 months. So huge impact to the practice, not only from a differentiation and clinical standpoint, but a really healthy profit injection for the practice. And that's what we have grown to learn, that can have the same impact on your practices as well.
And I just want to touch on that. So I've been in practice for 32 years, and for the majority of my career, I've been very surgical. And I'll be honest with you, I'm stepping away from surgery now and doing more of this, and becoming more profitable from doing that. College is expensive, as you all know. So, we want to do what that can help us. And, it's really, not only is it profitable, it's fulfilling. It's great to see people who had lost hope get better. So I'm a happier practitioner.
Love it.
It's great.
Chris, do you want to just quickly speak to the slide?
Yeah, I'll do it really fast. I know we're running a bit on time here, and you still have we have a little piece on marketing and some incentives. So please do hang in there with us, folks. Just I want to highlight on this, the blue highlighting really is the most important piece. All of us want to be Dr. Crushing It. I can imagine. I can't imagine not wanting to be Dr. Crushing It as the profile, and all that's trying to show is that, let's maximize our time at our practice, both for clinical outcomes, but really for profit as well. We're running a business, and Swift can contribute just over $1,100 per hour on average, which is a really, really strong financial metrics when you look at contribution in a podiatry practice setting. So the quote is good, it's relevant. Bigger isn't better, bigger is bigger, better is better. So maximize your time, get the return for your time.
Yep. Okay. I now want to dive in, and we'll try and do this in the next 5 minutes. This is going to be quick. The big piece when it comes to our partnership. So what we try to do differently than most is because you're partnering with us, and very transparently, we're motivated to send you patients and to try to help you see as many patients as possible, due to the fact that we sell these disposable tips. It's just the nature of our business model. So there's a lot that we do to partner up with you to try to bring patients through. And I'm just going to go through that now quickly. The first part of it is understanding that there is a significant untapped market of people in every local market. And what we do with you in our initial consultations, we figure out how many people are actually searching for plantar wart treatment or wart on foot. We go through a full analysis of how significant that market is in your area. We want to try and find these people. These are people who are looking and they're motivated to find treatment. And that's what we sort of help you do. Okay. So I know marketing isn't something that everyone is doing. I know it certainly was for me before we launched this business, something that I was, felt a bit fluffy. We take a different approach to marketing, which is very much feet on the street. And this is new. We started off with more of a digital approach, and we're now getting back to some really grassroots marketing efforts, which I want to talk about quickly. So first thing we do, and this is still important, and we've been doing this the whole time, but being found on the internet is really important. So when people are looking, we talked about the people who are searching, you have to be found. So right away, as become a Swift client, we help you get optimized so you can get found. We'll go through the data, but on average, our clients see 40 more patient engagements per month than they were previously before Swift. So whether that's phone calls, that's map directions, and that's website visits. So that's an average across all of our users. I've just highlighted that here. So we talk about monthly flow. So the question is over a 5-year impact. So typical lease life is around 5 years. That's going to be 2,400 patient engagements. So not all those people are going to become patients, but what is that conversion rate? Is it 15%? Is it 20%? Over time, we're going to help you get found, and ultimately that's going to result in a lot of new patients. We're also going to put up a landing page. So we do this for you. We get, there's 4 landing pages that we set up. And so we help you craft those. We've got all the content ready to go. We can do it for you, or we can work with your marketing agency if you have one to get that up. Next thing we do is a press release. So this goes out, and this is really good for SEO, and it's really good for notifying local agencies that you have this device. It's also good for content putting up on your website. But this is something we found has been really, really effective in helping with your rankings. This next step is the one that is most manual, but we've seen the biggest impact from. What we are doing now, and this is something we've just launched in the past month, is we're actually geo targeting. So we put a pin down in your location and we find all of the dermatologists and pediatricians primarily. We can go to internal medicine if you want as well. And we get a hard mailer. It's an envelope that goes out addressed to the doctor, and it's a physician's update. And it arrives and it lets them know that you've now made this investment in this device and that you are looking to treat their recalcitrant wart patients. Getting out, we host lunch and learns. We encourage them and any of your practice administrators to set those up. We actually pay for the lunch. We'll buy the pizza. We'll educate them as to why they should send their tough wart patients your way. This has been a really good way to plug into dermatologists. They hate treating them. They're happy to refer them to you. It's a nice, steady flow of new patients. We then get out to your current email base or your current patient base. So this is actually, one of the patient brochures that we made. We get this mailed out, and we also do it soft copy as well digitally to go to your current list. So there's a lot of people in that list that you've treated for warts over the last 5 to 10 years who still aren't better. And we want to go to them and say, hey, we've got something that can help you. It's a good way to bring out 5 to 10 patients early. Again, it's a race to get to 30, so we can pay the thing off as quickly as we can. If we get 5 to 10 coming from your current list, that's brilliant. So we go through a 12-month email sequence. We have the email sequence. We can do it through our email server, or we can do it through yours if you have one. Last one is amplifying for success. So this is the part where usually around 6 months, when you've had some success and you really want to ramp things up, we actually now go in on a co-marketing partnership. So this applies to any Swift user. So if there's anybody who's on the call now who wants to do this, please let us know. We will match. We have a really nice system now with social ads. We've done tons of testing with Google ads. Chris wants to kill me because I've dumped so much money into this research. But we now have an algorithm that we're really confident in. So if anybody wants to try to ramp this up, for every $1 you spend, we match it with 50 cents. Obviously, you guys make more money on Swift patients than we do. So we can't match 1 for 1, but we are willing to contribute in that success as well. That's it for what we do on the marketing side. There's more to the story. We'd love to run you through it. Quickly touching on some of the other stuff research-wise that we're looking at. Lots of interesting research happening with pre-cervical cancers and more advanced cancer treatment, melanoma treatment also. But the one that interests most podiatrists is with onychomycosis. So we are underway currently with private clinics, and our RCT starts fairly soon as well. So we're going to have some really good data. That research is looking really, really promising is all we can say about that. Okay, let's go into some questions. Chris, can you see Sarah Ann, any questions that have come through?
Can I just add one thing?
Yeah, of course.
So like to the attendees, the business model for Saorsa is to sell you tips. So they're invested in this to make sure that you do well. So that's, people sometimes huff and complain about it, but, if they want to see you get better, so they get better. So, that's the idea behind it.
Yeah, that was my favorite part as well. The science in treating patients is obviously a huge benefit to what you guys are doing, but the marketing that you're providing to your practices is huge. And I love how you kind of were like, and that's it. That's all we do. That what you do is huge. I mean, yeah, Google ads and email marketing. I mean, every physician needs help with that kind of stuff. And for you guys to make it easy and kind of just press play with templates, I think that's awesome. That's a huge benefit.
Yeah, no, we probably do undersell that a little bit. Now, some of the stuff is new as well. We're constantly sort of iterating on this piece, and seeing, testing, and seeing what works. But it's genuine. We're very keen, obviously, to to see you guys succeed. That your success is our success. It's very, very basic. So yeah, we're excited to bring more people on. There's about, Chris mentioned it, we've got 330 total practices now, roughly. And that leaves a lot of really good differentiation opportunities in a market as big as the United States. There are no markets currently that are oversaturated. right? That's there's lots of really good differentiation opportunity.
And so, Pete, did you just want to maybe highlight that slide you had on the incentive?
Yeah, yeah, sure. So for this spring promo that we're doing, it's a $4,000 capital discount that brings you to that 458 number that Chris had referenced, and then we're putting this $5,600 marketing package to work for you guys. So that's an agency that we work with. So we those are real dollars that we pay to them to do all this work. We help create the material, but they go and execute it. They're a lot smarter than we are when it comes to marketing. And we're giving you a free box of Swift tips to get you guys started with treatments. So if you are interested in learning more, we would love to hear from you. We can release the poll, which says, would you like more information on Swift? If you'd like,
let me do that.
If you guys would like some information, please let us know. And we will get it to you. Equally, if you want to email us, which is hello@esaorsa.com, or you can visit us, www.esaorsa.com, and we'd love to connect with you. We typically do an initial sort of video consult where we'll look at your local data, we'll pull up some Google Analytics, we'll do a free website audit, which is valuable in its own right. And give you our thoughts on how you guys would do with Swift, and obviously answer any questions you've got.
And also, everyone, don't forget that you can see all year round the virtual booth for the team at podiatrymeetings.com. If you go to our marketplace, there's a virtual exhibit hall booth and landing page with a lot of different resources that you can download. When we've got past webinars, we'll post this webinar, and then anything else that you guys will be promoting moving forward, you'll be able to find that information on that page. So it's really fun. You can hover over the different elements on the booth and information pops up. You can watch their videos, and yet we've got Dr. Catanella there as well. So we'll be updating this page as well, because I think, again, like, we want to get the most recent webinar posted, but there's a lot of information for you. Obviously, you can go to the official website, but it's kind of fun to come to our website as well.
Mm-hmm.
Awesome.
That's great.
Well, listen, thank you guys so much for hosting this, Sarah Ann. You guys are awesome. Thank you.
We're so glad that we had you guys on, because I tell you what, I get so many questions about, number one, how to pronounce your company name, which I did actually write it down this time.
I specifically avoided saying it because I know how to say it, but I always feel like I am still going to say it wrong. So I'm like, the Swift team, I refuse.
That's just fine.
That's no
problem.
When we were at the SAM conference and Sergio was there, he helped us out with our innovation theater session where we did speed dating with our vendors, and you guys were included. And when I was introducing everyone, I was literally looking at tall Sergio, and he's walking me through Saorsa, the providers of Swift. I'm like, I'm gonna get this. I got this.
Yeah. Quick story on that one, if anyone's still listening. It's Scottish Gaelic for freedom, so the technology comes from Scotland. I was trying to be very clever with trying to pay homage to our Scottish roots. Turns out no one can pronounce it.
Yeah, well, that's okay.
Most people go Saorsa.
Yeah.
So Chris and I now just go with Swift.
I think that's an awesome trivia question. Maybe we should put that, Sarah, in an upcoming newsletter or something. If you know what this means, you win $1 million. Well,
I don't know who's going to be paying that.
Pronounce it?
It will be in Monopoly money, of course.
All right.
Also, because everyone who did attend live, you will be entered into which Ann mentioned at the beginning of the webinar, you'll be entered into our monthly drawing. So every Practice Partner Academy session that you attend live, you'll get another name toss into the bowl and potentially win that $250. So go to our website, go to podiatrymeetings.com, look at Practice Partner Academy to see what webinars are coming up next. Saorsa, I did it. We'll have another webinar next quarter. I hope. I mean, I assume, and that would be fantastic. So keep your eyes
Absolutely.
peeled for the next one. And yeah, we always want to see everybody live because it makes it more fun when you're not just talking to a screen.
Yes.
Or yourself
That's
anyway.
right.
Yeah, so thanks everybody for spending time with us tonight, and thanks to all of our panelists tonight. You guys were awesome and gave us some really good information and tools. So again, email them if you need anything. It's hello@esaorsa.com, and I put the actual email address in the chat box.
Great.
Awesome.
Thanks so much,
Thank you guys
everybody.
so
Have a
much.
great evening. Appreciate
All
your
right,
time.
Good night.
All right.
Good night,
Take
everybody.
care. Good night. Bye-bye.
Take care.